Good evening. Thank you all for joining us today for this very important Q&A town hall on the COVID-19 vaccination for children. The District of Columbia Hospital Association, along with our member hospitals, are committed to provide accurate and timely information about the COVID-19 vaccine. We are certainly aware and understand the multitude of questions that parents have about the safety and efficacy of the vaccine. And our goal this evening is to answer your questions so that you can make the most informed decisions about the vaccine. This town hall will be recorded so that we have the opportunity to share it with an even broader audience. Tonight, we have a panel of experts from Children's National Hospital, MedStar Georgetown University Hospital, Howard University Hospital, and Mary Center. Our panelists include Dr. Claire Bogard, Pediatric and Medical Director of the COVID-19 program at Children's National Hospital, Dr. India Medley, Vice President and Chief Nursing Officer at Howard University Hospital, Dr. Ruth Cantula, Pediatric Infectious Disease Specialist at MedStar Georgetown University Hospital and an Assistant Professor of Pediatrics at Georgetown University, Dr. Maria Marquez, Administrative Medical Director at Mary Center and Professor at Georgetown University School of Medicine. I am Jackie Bowens, the President and CEO of the DC Hospital Association, and we are also happy to have the publisher of the Washington Informer, Ms. Denise Rolark Barnes, serving as our moderator. Denise, I want to thank you so much and let you know how grateful we are to have you moderate this evening, and we're all looking forward to both an informative and engaging discussion. Thank you, Denise, and I'll turn it over to you.
Thank you so much, Jackie. You know, I'm really happy to partner with you tonight and all of the other professionals who are going to be here this evening to bring education awareness to parents in my beloved hometown of Washington, D.C. You know, I hear from parents and community members often, and there's a lot of concern and hesitation around the Pfizer vaccine for children. And I'm happy to report our vaccination numbers in children have risen slightly to about 10% fully or partially vaccinated at the end of November to 23% to fully or partially vaccinated as of January 10. We're talking about a total of 11,781 children in total in the District of Columbia. But we have more work to do. And I think it's important that we make sure that our parents understand why, get all their questions answered and understand why this is important. Let's help lessen the hesitancy by fielding some questions to our physicians that are here with us this evening. And so I'm going to jump right on into the questions, and I'm going to start actually with Dr. Bogard. If you don't mind, we'd like to ask you, should elementary school age children get vaccinated?
Yes. I can also offer, I'm a parent to a first grader who just turned 7 last week. So she is eligible for the vaccine and has been vaccinated. But I'm also a mother to a 4-year-old who's not eligible and who is not able to get vaccinated. And so when we think about how this pandemic has affected the kids over the last 2 years, I think we as parents can all reflect back and just see the tremendous sacrifices our kids have made. COVID-19, even Omicron, can make healthy children have to go to the hospital, right? It can infect their lungs, their respiratory system, to make them sick enough to need acute care, to sleep over in the hospital, or even critical care in some cases. There's also the consequence of what we call post-COVID or long COVID. They think about 10% of kids are going to have symptoms longer than the typical week or two that some have. And these are strange symptoms. They're different in every kid. And we're trying to study them at Children's National to get a better understanding of what contributes to that and what makes kids more at risk for long symptoms. But there's certainly some kids that have lingering symptoms for weeks or months. And then finally, there's this consequence called multi-system inflammatory syndrome in children, which you'll hear the acronym MIS-C. And so MIS-C, although rare, it globally is about 1 in 5,000 kids that get COVID can get this consequence. It's almost life-threatening in every child and requires critical care. And I say this because, yes, if you look at the broad numbers, the kids that get sick and require these intense treatments or have all these long symptoms, the proportion is smaller than those kids that do fine, which is great news. But I think we as parents can also recognize that the medical consequences are just some of the consequences that these kids have had to experience because of the pandemic. The amount of school that children are missing, the amount of social interactions and the fun, even reflecting on the last 4 weeks in my own household, we have had an exposure that kept the unvaccinated one home for 10 days. And we have had an illness that kept the vaccinated one. It was not a COVID illness, but since the rules are so strict about returning to school now and testing was so hard to get, she was also out for a week. And I say this it's not a pity party for, Dr. Bogart. I just say that like these are consequences that are happening to kids that didn't even get COVID, right? Like this pandemic has just been hard and brutal, and it took them out of music class and it took them out of dance class. And my daughter's 7th birthday was spent without her grandparents, without the party we planned. I mean, there's real exhausting consequences to this, that if your child does get vaccinated, it keeps them in school longer, it keeps them healthier, it keeps them engaged in childhood, which is so important, as we all on this phone know.
Well, I'm glad you ended on that note, because we know that there is, it sounds like, the vaccinations do help in what parents are going through right now and what children are going through. We think about parents, but then what about the children? And I'd like to ask you, Dr. Medley, now that you're back with us, about children that are 12 and younger, and the importance of vaccinations for them.
Absolutely. Yes, I'm so sorry. I'm not quite sure what happened with that technical difficulty, but I'm certainly glad to be back. With our children, back to school, extracurricular activities, as was just mentioned, which is so much a very vital part of their growth and development. And with this pandemic, it has interfered with it. So we want to certainly get to life and living without having to worry about this virus, and especially for our children, so that they can expect to learn and grow and develop accordingly. So it is vital that they get this vaccine for their own growth and development and ability to get out into the community. But it's also for the next person. It's for their neighbor, for the other child in that classroom, for the teacher. And because everyone there represents family members, there are other people. It's not just a personal decision, it's a community-based decision, because this Omicron is so very, very contagious. I mean, you could not have any symptoms and still have the virus. And so that's what we really want to get our communities and parents to understand, that if it's not necessarily they're safe or they're okay because they don't have the symptoms, we still have to test them. And because some people just don't have the symptoms, but then yet they're very contagious. They can still cause the spread to another child, or another family member. And we want our children, fewer children to be sick. We have more children than we did when we did the last town hall meeting that have been hospitalized. And a percentage of them have had to be in the intensive care units. They've survived on a larger scale. They're not getting as sick as adults or older children may, but it's still very much a risk between the ages of 5 and 11 years of age. And so for the sake of wellness within the public health, our communities, and especially our precious children, we urge them to be vaccinated.
Thank you. Dr. Cantula, you know, the big problem out here among parents and others in the community is, you know, there's the fear of COVID, but there's also the fear of vaccines, whether the COVID vaccine is safe for children, particularly, you know, those in the younger age groups. What do you tell parents about the safety of the vaccines?
Sure. What I tell families about the safety of the vaccines is that we know based on the clinical research or the clinical trials that the vaccines are really safe. One of the things that I like for parents to focus on is how long and how careful the scientists were in doing the studies among children to determine the safety of the vaccine. So if you recall, the vaccines for children were not approved for months until after the adult vaccines were approved. In terms of the numbers of children who participated in the trial, so the numbers were similar. So there were two groups essentially. So there was the 12 to 15-year-old group where their vaccine was approved first, and then there was the 5 to 11 where their vaccine was approved later. So for both trials, about 2,000 children were in both trials. And then with that, there were some children that were put into the vaccine trial, and then there were some children that were put into what we call the placebo group. So among the children that were in the vaccine group, there were less children compared to the placebo group that got symptomatic COVID infection. And so that's how scientists determine the efficacy. So we know for the 5 to 11-year-olds, the efficacy was 91%, which is very good. And then in terms of safety, we know that there are some side effects of the vaccine, which are similar to what we see in adults. So pain at the vaccination site, children can get fevers, you can feel fatigue, and you may have some symptoms that will keep you out of school or activities for a few days, but they're transient and they're minimal. So that being said, we know that vaccines are safe for children.
I'm going to come back to you really quick, and then I'm going to go to Dr. Marquez. But as it relates to the safety, what do you advise parents or what do you as physicians look for before you can determine that the vaccine is safe for a particular child?
So the first thing is obviously age. We know that the vaccine is approved for children who are 5 and older. The second thing that I look at is the immune status of the child. So there are some children who are immunocompromised, and there are some children who I consider healthy at baseline. And then there are some children who have comorbidities outside of being immunocompromised. So having asthma, being obese, those sorts of things. The vaccine across the board is safe for all of those children. When it comes to the immunocompromised children, those are the children whose immune systems don't function like a normal healthy child. And I hate to use the term normal healthy, but those are the children whose immune system is compromised either by medication or an underlying disease. Those children in particular, when we give them the vaccine, we know that the vaccine, their immune system is compromised so that they don't get the same boost as a healthier child. So we know that we have to give them 3 doses. So those are the things that I consider as I'm thinking about who is going to get the vaccines. But for the whole, all children who are greater than 5 years old can receive the vaccine. Other thing to consider is if the child is sick at the time that they're scheduled to get their vaccine, we usually say hold off until your symptoms resolve before you get the vaccine. So that's the one consideration that I keep in mind when I'm thinking about who should get the vaccine and when. And for those children who have had COVID infection, we still recommend getting the vaccine. What studies have shown is that getting the vaccine after the COVID infection actually boosts your protection. So you develop antibodies from the infection, and getting the vaccine actually gives you additional antibodies towards protecting you from future infection.
Wow, thank you. Dr. Marquez, we're talking about, the vaccine itself and just the dosage for children. We know that, there are 2 shots and then there's the booster that we've all been told as adults to get. But what about children? Are they dosed the same way adults are?
So that's a great question, and thank you for the opportunity to be here with this tremendous group of panelists and the audience. So one of the things is that they did during the studies for this age of group of children 5 to 11 was to determine which was the minimal dose that was effective as the one used for adults, and also with the minimum side effects. And it's described that the vaccine that we recommend today is a third of the dose of the adult one or kids older than 12. So it is 10 micrograms each injection, and the adults is and kids older than 12 is 30. So they also say that even with this dose, we get the same amount or similar amount of protection antibodies. Those are the proteins, molecules that defend ourselves and against the virus or any bacteria or any infectious processes. So one of the things is it is also described that it has less side effects than older adults or people. So yes, they did make sure that that was the safest and the most protective dose that it was determined. It was a third of the other dose. And this vaccine is safe, and is a vaccine that has been studied for many years, different ways and different paths and different landmarks to make sure that it was produced massively in a very short time since March 2020. So it is highly recommended.
One of the things we know, though, that Dr. Marquez, is that children, just like adults, come in lots of shapes and sizes. And does that matter, or is it just age that determines the dosage?
It's age.
Okay.
Yes. We all humans come in different size and manners, right? We're all different. So yes, it's age. 5 to 11 is 10 micrograms, and it's a third of the kids that will get it after 12 or adults that will get it after 12 years old. Yes.
Wonderful. Okay, Dr. Bugard, I'm coming back to you because we want to know about whether children younger than 12 are at an increased risk of getting sick from COVID. And you've had lots of experiences from your patients, and it sounds like personally. So what have you observed, or, as it relates to the risk for children under 12?
Yeah, I think the last 2 years have been a roller coaster, and it has changed how we thought about this. So initially there was an encouraging thought that maybe COVID wasn't affecting children as seriously. And what we learned through both the Alpha wave, which was the initial infection, and then the Delta wave, which was the one that we had this fall, and now Omicron, is that we've learned, unfortunately, that some kids, and it's not easy to predict which ones, but some kids will have pretty devastating illness from COVID. But generally, kids do better than adults. And that's typically how it is with most infectious diseases. Kids' bodies are strong and they're very resilient, both physically and emotionally. And so their bodies do fight off illness better than older bodies. With that being said, though, throughout most of the pandemic, about 1 to 2% of COVID infections, or about 1 to 2% of children who have been infected with COVID end up in the hospital. If you just had 100 people, that's a very small group of patients, right? But as we know, especially through the Omicron wave, we've had, 1 million people tested positive each week over the last couple of weeks with this, right? So the amount of people that need hospitalization for this have been really high. What we've seen at children's through the Omicron wave is that most of the children's requiring hospitalization have been children less than 12. And what we think, at least with the Omicron wave, is most of those kids, of course, under 5, they cannot be vaccinated. And then most of the kids that we've seen require hospitalization and require intensive care are either children that were unvaccinated, children that were under-vaccinated, meaning they just had 1 dose instead of the full 2 doses, or children, unfortunately, that got 3 doses because they were immunocompromised, but their body still couldn't build the response that it needed to keep the infection away. And so the short answer to your question is that most kids will do fine if they're infected. But the problem is we don't know. I can't tell, even if I can read your patient's chart, I can't tell you that your child will be safe because we don't know why some people are infected more than others. 1/3 of kids who are hospitalized have no previous medical condition. So the safest thing to do is to get your kid vaccinated so they don't end up in the hospital.
Thank you. And Dr. Medley, Dr. Cantula talked a little bit to us about the side effects of vaccines, but I want to know, want you to weigh in on that too, as it relates to the Pfizer vaccine. What are some of the side effects, and have you had your own experiences, with patients, children who may have had some side effects, and how did you handle that?
Mm-hmm. Well, yes, thank you. There are side effects, and the side effects are very similar to those that adults experience. Pain at the injection site, maybe a fever, things like that, which are pretty typical for side effects for any immunization. What we found is that through the studies, that mostly the children between the ages of 5 and 11 had less side effects than adults, or than children older than 12 years of age, with the most common side effect being pain at the injection site, but not so much severe pain at the injection site. And these types of symptoms are expected to go away in a matter of days. So it's not unusual as to what they would have experienced after receiving the DPT immunization, measles, mumps, rubella, similar to those kinds of things, but certainly nothing that is that extreme or severe. Now, in the case where there may be that rare occurrence of severe side effects, again, as has been said repeatedly so far, it's very difficult to tell what the host body will do once receiving the vaccine. So we can't predict that. But if that should occur, then of course, the response would have to be engaging with the physician or the nurse practitioner, getting in touch with the medical system as soon as possible. But that is a rare occurrence. At Howard University Hospital, we have pediatric clinic, and we are giving children between ages of 5 and 11 the vaccine. And so we are finding that if there are any side effects, they're very mild. There has not been any overwhelming cases or instances of anything serious or severe. And another thing is that when the parents are bringing the children in for the vaccine, we are also assessing if the parents have been vaccinated, and there are several cases where not, and adults vaccine, so it's working quite well, and it's really a sign of our support, having a supportive environment for getting the children and their family members vaccinated.
And as it relates to all of you all, I mean, when a parent brings a child in to get vaccinated, is it part of the protocol right then and there to give the parent, I guess, advice or to tell them what to look for and what to do in case they see something before they leave? Is that part of the protocol?
Yes, it is. Even before giving the vaccine, You know, that information is provided, and it's expected. It's education, and particularly when you're dealing with a pediatric environment, it's anticipatory guidance. It's preparing them for what may happen or what the next step may be. And it's not always something negative or scary. It's just what to expect, and then what the proper response would be if that should occur. Absolutely.
Dr. Cantula, I know you were nodding to that question as well, and I'd like for you to weigh in on that. But also, you know, tell us, what are the vaccine choices for children?
So with regards to the information that we provide parents, one of the things that I want families to know is that we don't just give the vaccine and then send you on your way. We actually give you the vaccine, and then you're asked to wait for 15 minutes to see if you have any immediate side effects from the vaccine. So we take the information that we give you about the vaccine, and then we make sure that we take the time to observe you after getting the vaccine. So it's a process that we take seriously. I got stuck in that answering that question, and I forgot
the other one was just, what are the choices? What are the vaccine choices?
Oh, that's pretty simple. So the vaccine choices for children 5 to 11, it's just Pfizer at this point. And we know that the Moderna trials are still ongoing. We also know that that we'll have some data potentially in the spring on Pfizer vaccine for the younger kids. So right now it's just Pfizer for children.
Okay, thank you. And Dr. Marquez, I'm coming to you now because, you know, we're all walking around now with this, well, we should be with this vaccine card because, you know, there's places where we can't get in without it. We were able to put it on our phones and what have you. But do children need one, and do they receive one?
Yeah, they will receive the same card that anybody will receive at any age, and it will document the first dose and the second dose at this point for children 5 to 11 because they are not still approved for boosters. But yes, they will receive their CDC card, and it's recommended to keep it safely and take a picture. So if it is asked for, to have it handy.
Wonderful. That's you know, trying to hold on to those cards sometimes gets to be a little difficult. So is that something the child should, I mean, are there recommendations on how children should keep them, or is it better for the parents to hold on to those cards? It seems like it would be, but.
Yes, usually the parents hold on those cards the same as the vaccination record.
Right, okay.
The same way.
And yes, go ahead.
You know, Denise, if I may just add, some of our young people benefiting from their millennial role models, they're taking pictures, you know, from their cell phones, you know, and storing, saving the picture of the card on their phones. These are for those who may have a cell phone, or the parent would also take a picture of it and store it as well. That keeps it handy and not having to worry about keeping up with paper or the condition of the paper or the card.
Yeah, that's fantastic. I'm glad you called me a millennial because that's what I do.
My children are millennials, so I'm, yeah, yes.
I got you. So as it relates to COVID vaccines or giving COVID vaccines, at the same time, children are also taking other vaccines. And I'm going to go back to you, Dr. Marquez. You know, is it okay to get a COVID vaccine if the parent also wants a child to get a flu vaccine? And I think in some of those age groups, they're still getting their vaccines for other purposes that schools require. So how do you balance all these vaccines?
So the recommendation is to give the vaccine with any other vaccine. You know, the flu is the one that is the most popular between 5 to 11 years old at this moment. So we are giving flu and COVID, but if they need any other vaccination that is required from 5 to 11, it will be applied at the same time with the COVID vaccine. There's no side effects. They haven't been reported any concern about that. And it's recommended to get it as many as they need.
One of those conditions or that some children face, Dr. Bugard, is sickle cell anemia. And, you know, someone is asking, is it safe for children with sickle cell to get the vaccine?
Yes, in fact, that's a very high risk group if they get the infection itself. And so we would encourage the vaccination. Keep in mind the vaccine, I think vaccines are one of those things we all got as kids. Most of us got as kids. And so we've heard the term and we're like, yep, we get what vaccines are, the shots that you have to get to go to school, that type of thing. But when you study how they actually work, what's really cool about them is it's not, the magic of the vaccine is that it gives your body a piece of something or a small thing that is not harmful to you, but will prepare you to fight off something that is harmful. And what I think is pretty amazing is just, it's your body that's building this response. That's what causes that fever, those aches, maybe the headache, the lymphadenopathy after you get it. That's because your body's really doing the magic and fighting it off. And I'm a parent, like I said, I'm a human being, right? I had my own worries about both the infection and the vaccine itself. But I think what made me feel reassured about it was like, this is what my body does every day. When I inhale air without a mask on, I'm inhaling what's in the environment. My body is trying to figure out what should stay and what should go. And it's been doing this for more than 3 decades in my life. And so it's reassuring to know this isn't a new process for my body. I'm just tricking my body to be prepared if it sees the dangerous thing, to be able to fight it off beforehand. And so I know I was reading through some of these comments, just like you will get exposed to COVID if you're not wearing a mask, whether you're vaccinated or not. Now, whether you develop symptoms or whether you have enough vaccine enter your body that can't be destroyed fast enough that you share it with someone else, the vaccine is what makes you less susceptible getting sick and less susceptible to sharing with someone else accidentally. And so if you don't have a barrier on, you're going to be exposed, but that's why that's the magic of it. Your body, it will enter your body and we'll be able to fight it off. And I find that reassuring. It's not some magic goo that's floating around my body and protecting me. This is my body doing what it's done every day since I've been alive. And I think that is reassuring.
So again, I'm going to come back to you because with children in your life, you know, the whole issue of wearing a mask. And so it sounds like, you know, you support that idea with children, but what kinds of masks should children be wearing?
Yeah, I think we've learned a lot about masks, more than I've ever wanted to know in the last couple of years, but certainly there are like hospital grade N95 masks, which are the ones that protect the healthcare workers that are most exposed, that have to do this day in and day out for hours on end. Then those are not commercially available easily, I should say, and they're usually pretty expensive. So what we mostly have are the cloth masks that people wear. And what we know is the more cloth masks you wear, so like 2 masks is better than 1. It prevents more stuff from getting inside of you. There's also these KN95 masks, which are also available, which just have more filters. There are some masks that come with filters. And so the more layers you have, the more protected that human being is from breathing in whatever virus might be floating through the air, but the most predominant right now being Omicron. And so those are the barrier methods, along with being socially distanced, washing your hands to protect yourself from being infected. But we get a lot of questions about this, like, well, what if my kid just stays 6 feet apart and wears masks? Or what if, you know, we have the special mask? What I can still tell you is people are still getting infected, even if they're wearing a mask, though much less likely. And also keep in mind, kids don't really socially distance the way we want them to. Their masks don't really stay on the way we always want them to, just like they don't make the bed the way you want them to, things like that. It requires a lot of reminding. And I think about the beautiful teachers who work day in, day out, they're trying to constantly remind kids. So the mask is definitely a piece of this, but the best protection is the vaccine.
Wonderful. Dr. Cantula, one of our attendees says that she received the vaccine while pregnant. And she wants to know if you or any of you have information on longitudinal effects that the vaccine may have on her child.
So we know that the vaccine is safe during pregnancy. And one of the nice parts about the body making these antibodies is that these antibodies are transferred from mother to child during pregnancy. And we know that when antibodies are transferred from mother to baby, that the antibodies stay in the baby for at least 6 months. And this is just generally speaking about antibodies in general. So mothers transfer a lot of antibodies to their babies. We don't know how long the COVID antibodies stay, but knowing how long the other antibodies stay, and when I'm speaking in general about antibodies, I'm talking about antibodies to vaccines that mom has had in the past. I'm talking about antibodies to illnesses that mom may have had that she developed protection against. This is why, for the most part, young babies don't typically get that sick. It's because mom's antibodies are protecting them. So roughly, I would say about 6 months, but that's just based on what we know about antibodies in general. So I would encourage any mother or any pregnant woman to get vaccinated.
I'm going to add a question to that too about nursing mothers. Does it add? I'm just going to ask about nursing mothers. I don't know what to ask, but just
no. I know what you mean. So
yes,
the same is true. So mothers pass on antibodies through their breast milk,
right.
And that's why breast milk is so great. So moms are passing on antibodies when the baby is inside of them, before the baby is born. And then when moms are breastfeeding, they're also protecting baby from getting sick with antibodies. So, I think getting vaccinated is fantastic for pregnant women because we don't have vaccines for children who are less than 5 years old. So if we can provide some protection for infants, I think that's fantastic. So I would encourage any pregnant women to get vaccinated.
Have you all seen instances of infants or newborns with COVID? I'm just curious.
So I guess I'll start since I'm already muted.
Dr. Marquez, because I've got another question for her, but I'm curious. But go ahead.
Oh, I was going to say, I have seen infections of COVID in babies. And this is just to highlight how important it is to get vaccinated. So at Georgetown, I also work in the NICU, which is the neonatal intensive care unit. Just to show the risk, there are babies in the neonatal intensive care unit who are getting COVID infections. And the problem there is that we don't really have any medications to give them. They're already small. Some of them are on ventilators requiring extra support to breathe. So it's a very serious and very dangerous situation that can happen when a baby gets sick with COVID. And the same is true for when a baby who is born at full term getting sick with any respiratory illness, because their lungs are much smaller and their tubes are smaller, their air tubes are smaller than ours. Sometimes when they get sick, they get really, really sick and they get plugged up with mucus, and that can also cause them to be admitted to the hospital, having to have extra support to breathe. So it's really serious when we talk about wanting to prevent infections in neonates and young children.
Thank you. Dr. Marquez, I didn't know, I saw you nodding to that one too. I don't know if you wanted to address that before I move on to another question that someone had. But.
So yes, I think Dr. Cantula did a great job. We just transferred one patient from the clinic. I work mainly in the outpatient clinic with a newborn COVID positive when he was discharged, and parent didn't know, but my parent was also COVID positive, not vaccinated. So actually, it's very important that if you can get the vaccine while pregnant, especially in the third trimester, is even better because it can get you very sick if you get the infection while being pregnant. It has been described that the severity of the disease is higher than than, if you're not pregnant. And then also, so it puts you at risk. And also, it has described and published and studied that it causes prematurity as well. So I really think, and it has been also studied in a way that it has been very safe on pregnancy, during pregnancies, recommended mainly and during the third trimester. But if you can get it, please get it. It's very important for the child. I as a pediatrician, I believe that, the disease or the severity of a very sick child is, even if it is less the number, is detrimental. I think, we have had some children that had died in the country. And also, I want to remind everybody that less than 5, we cannot vaccinate. When you vaccinate one person in your household, you protect 60% of your household members. So it's not only about us, just of course first us, but it's also about others in the household and in the community. And if you vaccinate 3 people or more in your household, you protect more than 90% of your household that cannot get the vaccine. So those will be the young kids and the newborns and people who cannot get the vaccine for specific reasons. So it really is highly, highly, highly recommended. I believe this is something that as a community, because if we have a lot of people that is not vaccinated, the virus is going to keep changing. It's going to keep infected. And when we don't have protection, the virus sees the opportunity to really mutate, and that means change and be more aggressive and attack more. And it's going to be really, really hard for us to win this war if we don't get together, get all protected, get a shield, and make sure that we all together, union is a big force, fight this virus and maybe win this war soon and be in a better future very soon. And I want to really highlight this because it's important. We just transferred a newborn yesterday and he was really sick.
Speaking of a war, the next question talks about, I think, one of the weapons that someone is questioning whether it works in this war and against COVID in households, and that's the weapon of Lysol sprays. Does it help, Dr. Marquez, to spray your house with Lysol? Does it protect people from being exposed?
I mean, good hygiene and precautions, universal precautions is always good. I want to make sure that I highlight again, as Dr. Boger mentioned before, the number one tool we have to protect us is the vaccine. It is the vaccine. If there are questions about the vaccine, please, please, please contact someone you trust that knows science about the vaccine and can answer your questions. That's the number one thing. It's not going to be easy just for us to go knock at your door and say, we have the vaccine, do you want it? No, if you don't know who we are. So if you have people who you trust, could be family members who works in a hospital, family members who knows about science and health, your providers, your PCPs, your pediatrician, your adult medicine, family medicine provider, please, please answer the questions because that's the number one tool. And I think the second one is the mask that we already highlighted, and we gave you all the types that are necessary. Any mask that you find is the number one thing, and hopefully the one that you can breathe through. I think that's the number one choice. There are others that are recommended that are being more protective, as we mentioned before, harder to find, maybe more expensive. The government is really helping us to have it in a way that is secure for all of us, and hopefully we all going to have the one that is supposedly more protected, the NK95 or N95. So it is something that Lysol, yes, it helps, but it's not shown that it kills the virus. This Omicron has been extremely aggressive and very infective. So it stays longer in the air, is really like, extremely infected. So if you are in contact with someone that has the virus, who may have symptoms or not, and then you are without a mask, most probably you're going to get the infection. And again, as we already described, is we don't know if you are one of the high risk population that can have serious disease, some of which not only for children, I believe is also for adults. We don't have that answers today, but it's going to come at some point that some people is more vulnerable and we don't know why. And it doesn't necessarily have to be the co-processes or co-diseases. Like we know some of them are increase our risk to be sicker, like asthma, diabetes, and high blood pressure, heart disease. Okay, but it's something that I think in our own metabolism, I don't know what it is, that protects us in some way. So I really think I want to highlight again the vaccine number 1, mask number 2, and then yes, hand washing number 3, and cleaning your house and using disinfectant works, but we don't know how much. We don't still have the statistics for that. We know that 91% in children 5 to 11, if you get the vaccine, you're going to be protected. Also reducing the death and severity, that is around 99% if you're vaccinated with the booster and everything. So, it really, we cannot minimize the power of this vaccine.
Thank you. And I just want to say to those who are watching, please submit your questions. I'm trying to get to as many as we can. So if you have questions, this is a great time to ask. And the folks are here to answer your questions and to give you the best advice that they can. Dr. Bugard, how can a parent best protect their child under the age of 5 until they get vaccinated?
Yeah, I empathize with you. I saw that question. I was like, I'm right there with you. But good news is I think we will have an opportunity to vaccinate our kids within the next half year. I wish I had the magic ball to tell you when that will happen. I know all of us were really hoping it would be before Christmas, but unfortunately, this is also reassuring. The scientists said it didn't, like they studied it well, and as much as people wanted it, they were like, it doesn't work that well. It's safe, but it's not working that well in kids. So we have to go back and study it longer. So we're waiting for the data. But until then, the goal is just to keep them as healthy and happy as possible and to keep them engaged in their environment as best we can. So what I do in my house is just, I follow the school's guidelines of wearing a mask, and I trust them to do the things that they've told me that they're doing in school to try to keep them safe with hand washing and having them eat separately and things like that. And then I've vaccinated my household members who can be vaccinated. And then the other thing I would mention, I saw this in one of the questions too, because it is frustrating if you have an unvaccinated child of any age. Most schools, if you're exposed then, are taking your child out of school for at least 5 days, if not 10 or 14, I've heard. So there's not much we can do about individual schools making choices, right? I mean, you as a parent might be able to advocate to have your school follow the new CDC guidelines. But children, for the most part, because they can't consistently wear a mask and they can't, most schools are populated to a place where they wouldn't be able to allow kids to eat and wear a mask at the same time, that most schools are still keeping that 10-day quarantine for unvaccinated kids. So if your child is under 5, I would say just stay vigilant. I know it hurts and it's painful and it's hard, and lean on your friends and family as much as you can. Ask your employer. DC is actually a really employee-friendly city for things like this, which is great. But at the same point, if your child is able to be vaccinated, please just consider, I know this is the same mantra we're going to say for everything, but having a vaccinated child keeps them in school, keeps them healthy and safe. The vaccine's also free. And yes, you're right, your body could fight it off and you could be fine at home. But if you have to go to the doctor, if you're one of the people who have to wait in the emergency room, if you have to have an ambulance ride or hospitalization, we know in America, those aren't cheap visits. And so we want people to be able to have an easy start to this year so we can get out of the pandemic together.
And the follow-up, someone asked, what if their child is about to turn 12?
Great question. We get this one a lot. I would say the best vaccine is the vaccine you can get soonest. So there's nothing magical that happens on your 12th birthday with your immune system. It's safe at the lower dose and it's safe at the higher dose. What's interesting is the CDC said if your child is going to turn 12 within the next 3 weeks, you actually have the choice. You can ask for the higher dose or the lower dose for both doses, or your 11-year-old can get the 11-year-old dose, and when they turn 12 for their second dose, they can get the higher dose. So there is some flexibility. So if you feel more comfortable with the lower dose or you want the higher dose, as long as your child's bridging that 3-week mark, you do have the choice according to the CDC.
Wonderful. Dr. Medley, this is a power-packed question here. They want to know, again, about the clinical trials that have been conducted to determine the long-term effects on children. And if so, how long were the trials? What were the age groups? We talked about that a little bit earlier, what the age groups were. I think Dr. Cantula answered that, but you can address it as well as ethnicity.
Right. So the age groups, again, and that's why the vaccine is strongly recommended for ages 5 through 11, because those were the age groups that were tested in the clinical trials. And so it turns out, through the studies and these outcomes, that the children that received the vaccine versus the children that had the placebo children actually developed or had COVID-19 in a higher percentage than those that had the vaccine. So, and again, ages 5 through 11. And was there another part to that question? I'm so sorry.
Yeah, one was the other part was ethnicity, but also how long were these trials conducted? What was the period of time that these trials were conducted?
I'm thinking back and trying to really recall the length of this study. I have in my mind, actually, I don't know if anyone else wants to join in and contribute about the length of time for this study, but I do know that they had very large sample sizes as part of the children that were tested in these clinical trials. I don't know. Does anyone else have that information regarding?
Dr. Cantula,
I can jump in. So the answer to the length of the trials is the trials are still actually ongoing, meaning that we are looking at the long-term side effects. So the trial portion that people focus on, where somebody got the placebo or the vaccine, the way that they did that sort of trial is you got a placebo or you got a vaccine, you were monitored for months after you received or weeks after you received your second dose to see if you got an infection. But the trials are actually ongoing to see how long the protection lasts. So we know that from the adult studies that the protection seems to be, and when I talk about protection, I'm talking about the antibodies. So we know from the adult studies that the antibodies seem to be with us for about 6 months, which is how they got to the number for the booster. And so around 6 months, I mean, it just doesn't disappear, but it wanes. We say it's like gradually going away. So the purpose of the booster is to give you more antibodies in case you were exposed. So the purpose of the booster is to continue the long-term protection, which is really important in a pandemic as this virus keeps changing and changing. So the purpose of the boosters is to continue to protect us. And we know that the virus is going to keep changing. Because everything is so new in terms of this virus and the COVID vaccines, we're still learning along the way, if all that makes sense. I hope I was able to answer that question. So really, in short, we're still learning about the long-term side effects in children. And so far, there haven't been any significant long-term side effects that would make us stop giving the vaccines to children or to anybody for that matter.
And so that implies, I guess, an answer to the other question, but I do want to ask it anyway, and anybody can jump in, because a lot of times we know that clinical trials are not always, equitably conducted. I mean, a lot of times, children of color or adults of color or whatever don't participate. So is there any information any of you all have about the ethnicity of the children that participated in the clinical trials?
Yes, I meant to, when you mentioned it earlier, that, children of Hispanic or African American heritage are considered at higher risk, for getting the COVID vaccine. And then if there are going to be side effects, depending on whether or not there are other diseases or conditions that they've had, which we call comorbidities, prior to receiving the vaccine, then they are at risk for having side effects or needing, as was mentioned several times by my distinguished colleagues here, needing to get that third shot or a booster because of compromised immunity due to other illnesses in their body. So just like with the adult community, being part of a minority heritage or background would put the children in a high risk category as well, especially if they have other illnesses like sickle cell anemia or conditions such as obesity and heart illnesses, heart diseases, diabetes, things like that, just like their family members, that are older.
And on that note, Dr. Bugard, you might be able to answer this, or anybody really, but asthma to me is it seems like, because that's so prevalent among particularly children of color, children east of the river. I know in Southeast there's a high incidence. I think you all even had a program for children with asthma here. So I mean, does the vaccine affect children more or better, or what is the impact of the vaccine with children who have asthma?
There's been no specific study comparing those with asthma who got the vaccine and those that didn't. But what I can tell you is those with asthma are increased risk of poor outcomes from the infection, and they are protected when they get the vaccine. So if you look at a group of kids with asthma, those that get the vaccine are much more protected than those that did not. And their risk of hospitalization, death, poor outcomes is much lower if they've been vaccinated. I think it's important. Or in the original study for the 5 to 11-year-old, they really tried hard to get a very diverse population of people. But like you said, Ms. Barnes, like the trust with the African American community has been eroded so many times in our history that it's hard. It was hard to convince a lot of people to do it. And so the initial study only contained about 10% of people that considered themselves Black or African American. But what I would want to remind parents is this has now been given millions of times, tens of millions of times around the world. And what we want to do is remind you that as doctors who are giving this, we have the responsibility to report anything, any kind of bad reaction, any reaction that we might not even if we don't think it's relevant to the vaccine, we are mandated by law to report it to the CDC through a system called VAERS, which I saw someone mention in the comments. The CDC gathers all that information and studies it because they don't want to be hurting people in the public. This is for protection. They want to keep people safe. And so as Dr. Cantula said, the study participants are being studied for 2 years, but so is everyone else. We are obligated by law to report any adverse reactions. And I agree, especially in the 5 to 11-year-olds, the risk, the biggest side effect we're really seeing is people with sore arms, and then they get those immune side effects that we expect. But there's been no reported cases in my hospital of like an allergic reaction to it that caused, an emergency room visit or anything like that. And no cases of myocarditis. I know someone was worried about that in the chat too. Myocarditis is an inflammation of the heart muscle and the tissue around it that we know can be caused by infections. And what we found was a small group of adolescent boys and young men seemed to develop this myocarditis after the second shot of the Pfizer vaccine. What we know is myocarditis in general affects this age group, this young men age group. And we don't necessarily know why, but the good news is that the myocarditis that came after the Pfizer vaccine itself was a low proportion of kids. And there was a study that came out in November that showed after 28 days, none of them had symptoms. Very few of them needed any kind of intervention, whether it was a doctor visit or medication, and very few people needed hospitalization. That's very different than the myocarditis that we've seen with the COVID infection, which definitely requires medication and treatment. So just to speak more to that, and like the long-term side effect issue too, there has been no vaccines made to date in the, over 100 years of vaccines that have ever had late onset side effects. And again, I just keep going back. Remember, like your body's doing this all the time. We're just asking it to do it to something specific in a very controlled environment. And so there's no reason to think that we will, all develop a poor side effect down the road. Biologically, that doesn't make sense. And what we've done is studied it very now intensely for at least over a year now in the adults, and we're watching it just as carefully in kids. So if that can help anyone feel even more safe about this, the more people that get it, we're studying it, the more numbers and the more data we get as scientists, the more reassured we are by this vaccine, which is really helpful for me as a parent to feel safer and safer about the choice I made for my kid.
No question. Dr. Marquez, just a quickly, a caller of attendee wants to know when the vaccines are available for younger children, will they be available in the district?
So we, again, like Dr. Booger kind of alluded to this, we don't know when less than 5 is coming, but 5 to 11 is actually very available in the district. It's also, if you go to vaccine.gov, you can put your zip code or your phone number, and then it can tell you where near you is the vaccination COVID vaccine center. And it's an amazing web page. Each of us, MedStar, Georgetown, and Children's Mary Center, Howard, have a lot of information where to get it. We do this every day, all the time, 5 to 11. And I think Mary Center, believe it or not, during COVID, we kind of intentionally did an extra effort using the team, an amazing team that making sure that we had a high vaccination rate. And I think it is now after, and I mean really not only for COVID, but all the vaccines, because a lot of people were behind in that way because you were isolated, you were locked down in some way. So it is something that it happened. We have a very high rate of vaccination. So it's all around us, and it's free, as we mentioned. You don't need insurance card. You don't need ID. I mean, if you have an arm and the vaccine is there, please get it. And it's very available. They really make it very easy to get the vaccine. And growing up in another country, I mean, I can tell you, I'm very proud of what happened here. And of course, I'm a pro-vaccination 100%, but it is something incredible what really happened. And I hope one day in the future, retrospectively, we're going to see what they did with this vaccine and how they tried to really make sure it's available and protecting all of us.
Wonderful. Well, I want to thank all of you all. We're kind of going over time now, but that's fine. I think that you all have given some great information. I want to ask each of you all to give some closing thoughts, and my camera's frozen, so I hope you heard what I said. So I'm going to start with you, Dr. Cantula. Do you want to kick us off with some closing remarks?
So again, thank you for allowing me to participate in this event. The one thing that I just want everybody, and I say this all the time, if you're eligible to get vaccinated, please get vaccinated. And like Dr. Marquez said, the more people who are vaccinated in your household, the more protected your household is. So I'll just stop there, but please get vaccinated if you're eligible.
Dr. Marquez?
We're going to echo the same thing. I already mentioned it. I mean, if you have an arm and you have the age, please get the vaccine. And if the vaccine is there, it's really available. It has been an amazing process. Again, get the vaccine for you, for your family, for all of us.
Dr. Medley?
Our children are our most precious commodities, you know, as human beings. And if our children are able to be in good health, and we're supporting that and really prioritizing their wellness and preventive measures, then our society will be safe. And so I really strongly urge everyone to please, if you are eligible to get the vaccine, please do so. It's for our present and it's for our future. And it's for a very our healthy communities and societies. And I'm very grateful. I consider it a blessing to be able to have the vaccine and that it's for free as well. And I just hope that we'll all take advantage of this, getting the vaccine and of the opportunity of being well. And thank you so much.
Thank you
for having me here.
Dr. Bugard, you can close us out.
Sure. I just want to thank you guys for having me as well. And then for everyone on the call or who might hear this in the future, if you're still hesitant, like Dr. Marquez said, talk to someone that you trust in the medical field that has the right information they can share. And then for all of us, just remember this is a community effort. So just be very cautious about the information you share with each other. Make sure it's accurate and appropriate. Make sure that you go out and you share information that is correct. I think there's just a lot. This is a really bad game of telephone that has taken place. I think everyone who's hesitant, I can empathize with completely, because this has been very confusing. There's different messages coming out all the time. It's real life science in the works. And so just keep in mind, like, we all question ourselves before these, right? We go back on, we reassure that the science is still the same, and it's been confusing, but we as physicians can only speak to so many people, and people only trust us to a certain extent. The people that we really trust in our lives are our friends and family, and that means we all have power to end this. So just please be cautious about the information that you're sharing, and double check it with people that you trust, because there is a right answer. This isn't opinion. This is really science-based, which builds our confidence with the safety and the efficacy, and we hope you take advantage of it.
That's perfect. I want to thank you all for being with us this evening. I certainly learned a lot and appreciate the time that you spent. And I guess I'll just end by saying what you just said, Dr. Bugard, and that is, first of all, do something, make a decision and talk to people, talk to someone you trust, and then double find someone else, or what did you say? Double check with someone else that you trust, but do something. Don't sit by and let the virus control you. So I appreciate you so much this evening, and have a good night.